Eat eggs, but never make these 7 mistakes. They can be fatal. Vertical bar senior health tips. Eggs have long been considered one of the most nutritious foods available. Packed with high-quality protein, essential amino acids, vitamins, minerals, and healthy fats, they provide seniors with a valuable source of energy and nourishment. For older adults, eggs are especially important because they support muscle strength, bone health, brain function, and overall vitality. However, while eggs can be a powerful ally in maintaining wellness, consuming them incorrectly or neglecting certain precautions can turn this superfood into a potential health hazard. As people age, their bodies undergo physiological changes, such as slower metabolism, weakened immunity, and increased risk of chronic illnesses like heart disease, diabetes, and digestive issues. This makes it especially critical for seniors to handle and consume eggs properly. The wrong choices, ranging from undercooking to excessive intake, can lead to serious complications, sometimes even fatal consequences. The following guide explores 7 common mistakes older adults must avoid when eating eggs, explaining the health risks behind each error and offering safer alternatives. Mistake 1. Eating raw or undercooked eggs. Raw or undercooked eggs may seem harmless, but for seniors, they pose significant risks. Eggs can carry bacteria like Salmonella, which causes severe food poisoning. While younger people may recover quickly from such infections, seniors often have weaker immune systems that cannot fight off harmful pathogens as effectively. What might be mild stomach discomfort in a younger adult could escalate to dangerous dehydration, hospitalization, or worse in someone over 60. Eating raw eggs in smoothies, salad dressings, or desserts increases the chances of infection. Soft boiled eggs with runny yolks or sunny side-up styles that leave the yolk uncooked can also harbor harmful microbes. Symptoms such as diarrhea, fever, abdominal cramps, and vomiting may appear within hours, posing immediate danger to health. To avoid these risks, eggs should always be cooked thoroughly until both the yolk and white are firm. Scrambled, boiled, or fully cooked omelets provide the nutrition without the hidden dangers. Mistake 2. Overeating eggs daily. Eggs are nutrient-dense, but moderation is key. Seniors often face higher risks of heart disease, high cholesterol, and weight gain. Eating too many eggs daily can elevate cholesterol intake beyond recommended levels, particularly if consumed with high-fat cooking methods like frying in butter or oil. Although the cholesterol in eggs is less harmful than once believed, excessive consumption, such as more than 2 eggs per day, can still pose a danger for those with existing heart conditions or diabetes. Overconsumption may contribute to plaque buildup in arteries, raising the likelihood of heart attacks or strokes. The safe approach is to balance egg intake with other sources of protein, such as beans, fish, or lean meats. Most seniors benefit from consuming around 4 to 6 eggs per week, depending on their overall diet and medical history. Consulting a healthcare provider for personalized recommendations is the wisest step. Mistake 3. Frying eggs in unhealthy oils or butter. The way eggs are prepared is just as important as how many are eaten. Frying eggs in butter, margarine, or refined oils can turn a healthy protein source into a harmful meal. These cooking methods add excessive saturated fats and trans fats, which increase cholesterol levels, promote weight gain, and contribute to cardiovascular disease. For seniors, clogged arteries and poor heart function are particularly dangerous, as they can lead to reduced blood flow to the brain and other vital organs. Cooking eggs in bacon grease or combining them with processed meats like sausages or ham compounds the risks, creating a meal high in sodium and fat that strains both the heart and kidneys. A healthier approach involves boiling, poaching, or steaming eggs. If frying is preferred, using small amounts of olive oil or avocado oil is a safer choice. Combining eggs with vegetables instead of processed meats enhances nutrient intake while reducing the harmful load of fats and sodium. Mistake 4. Storing eggs improperly. Egg storage is often overlooked, but mishandling eggs can expose seniors to dangerous bacteria. Eggs should always be refrigerated promptly, as leaving them at room temperature for extended periods encourages bacterial growth. Consuming eggs that have been improperly stored increases the risk of foodborne illnesses, which are more severe in older adults. Many seniors make the mistake of keeping eggs in the refrigerator door, where temperature fluctuations occur every time the door opens. This can reduce freshness and increase contamination risks. Instead, eggs should be stored in their original carton on a middle or lower shelf inside the refrigerator, where the temperature remains stable. Additionally, eggs should never be eaten past their expiration or best before date. Checking for freshness by placing eggs in a bowl of water, fresh eggs sink, while old ones float, can help prevent accidental consumption of spoiled eggs. Mistake 5. Ignoring medical conditions when eating eggs. Not all seniors can safely consume eggs. Individuals with diabetes, kidney disease, or high cholesterol must be particularly cautious. For those with type 2 diabetes, excessive egg consumption has been linked in some studies to increased risks of heart problems. Similarly, individuals with chronic kidney disease may need to limit protein intake, and eggs could place additional strain on already compromised kidneys. Another issue arises for seniors with gallbladder problems. Eggs are high in fat, which can trigger painful gallbladder attacks in sensitive individuals. Those with a history of gallstones or gallbladder surgery may find egg consumption uncomfortable or risky. It is essential for older adults to discuss their dietary habits with their doctors. A healthcare provider can determine how many eggs are safe to eat based on individual health conditions, ensuring that the benefits outweigh potential dangers. Mistake 6. Eating only the yolks or only the whites. Many seniors mistakenly believe that eating only one part of the egg is healthier. Some avoid yolks out of fear of cholesterol, while others consume only yolks, assuming they contain all the nutrients. Both approaches are misguided. Egg yolks are rich in vitamins A, D, E, and B12, as well as choline, which supports brain health and memory. Avoiding yolks entirely can deprive seniors of these critical nutrients. On the other hand, consuming only yolks and discarding whites eliminates an excellent source of low-fat, high-quality protein that supports muscle strength and bone health. The healthiest option is to eat the whole egg in moderation. By doing so, seniors receive the full spectrum of nutrients, protein, healthy fats, vitamins, and minerals necessary for maintaining energy, cognitive function, and overall well-being. Mistake 7. Pairing eggs with unhealthy side dishes. The benefits of eggs can be undermined by unhealthy accompaniments. Many people enjoy eggs with bacon, sausages, fried potatoes, or white bread. While tasty, these combinations load the meal with sodium, trans fats, and refined carbohydrates, which contribute to hypertension, obesity, and heart disease. For seniors, such dietary choices increase risks of stroke, kidney damage, and reduced mobility due to excess weight and poor cardiovascular health. A breakfast of eggs with greasy meats and processed bread can cause more harm than good, even if the eggs themselves are cooked properly. A better choice is to pair eggs with whole grains, such as oats or whole grain toast, and plenty of vegetables like spinach, tomatoes, or mushrooms. These combinations provide fiber, antioxidants, and additional nutrients that support digestion, stabilize blood sugar, and enhance heart health. The right way for seniors to eat eggs. When handled wisely, eggs can be an essential part of a senior's diet. To maximize benefits and minimize risks, the following practices should be followed. Always cook eggs thoroughly to eliminate harmful bacteria. Limit egg consumption to a moderate amount each week, balancing with other protein sources. Prepare eggs using healthy methods such as boiling, poaching, or steaming. Store eggs properly in a refrigerator at consistent temperatures. Consider individual health conditions before including eggs regularly in meals. Consume both the yolk and white for a complete nutrient profile. Pair eggs with nutrient-rich, unprocessed foods to enhance overall health. By following these guidelines, seniors can enjoy eggs as a nourishing and safe part of their daily diet without exposing themselves to unnecessary health hazards. Conclusion: eggs are often described as nature's multivitamin, offering a compact source of essential nutrients that are especially beneficial for seniors. Yet, the same food that supports strength, energy, and cognitive function can also become a silent danger if consumed carelessly. Eating raw or undercooked eggs, overindulging, cooking with unhealthy fats, storing them improperly, ignoring health conditions, separating yolks from whites, or combining them with harmful side dishes. All of these mistakes can increase the risk of serious health complications. For seniors aiming to live longer, healthier lives, the key lies not just in eating nutritious foods, but in consuming them correctly. Eggs can remain a valuable ally for vitality and longevity, provided they are enjoyed in moderation, prepared with care, and paired with wholesome foods. By avoiding these 7 critical mistakes, seniors can protect their health while continuing to enjoy one of the most versatile and nourishing foods available.